Good morning. It's Friday, October 14th. I'm Alexis Del Cid. Welcome to the Morning Medical Update.
For me, I just want as normal as possible. So symmetry and things like that.
Christie Ellis knew she wanted to undergo breast reconstruction surgery. Little did she realize her stomach tissue would be key to restoring her breasts. We'll meet the team here at the health system responsible for making it all possible. And we have an update on how COVID impacted efforts to find a cure for HIV. Also, making a delicacy. Simply put, it's too delicious to be healthy, but it's so good. You're going to want to save your calories for this one, or maybe plan an extra workout, or both. In this week's Foodie Friday, Chef Eric shares a chicken and waffle sandwich recipe. Chicken and waffles. Sounds so good right now. It's Friday, TGIF. Thanks for joining us here on Facebook, YouTube, and Twitter. Jess is enjoying a day off today. I'm in for her. We're live at the Dolph C. Simons Jr. Family Broadcast Studio. And we know you have questions for our doctors. They are ready to answer them. The links are on your screen, and you can also post your questions in the chat below. Today, we're talking about a complex surgery that was the top choice for breast reconstruction for Christie Ellis.
I just appreciate them. What they do is complicated and difficult.
Christie Ellis is beyond grateful to be living a normal life again. She shares the important decision she made very early on when doctors recommended a mastectomy to treat non-cancerous but aggressive breast tumors.
Well, it actually started back in 2018. I found a lump in my breast and saw the doctor about it, and luckily it was not cancerous. It was benign, so I was lucky with that. We were hoping just a simple removal of the lump would fix it, but they found that the type that it was one that would continue growing. It's called a phylloides, I believe. So if they didn't get all of it, it would continue to grow. So I had 2 surgeries on it back in 2018 and then another one in 2020. And we thought we had it all back in 2020, but this year I started to see more growth and it was getting bigger and angrier. It's just the left side, yes. So the right side is fine and everything. So I'm going to work with Dr. Farmer. I'll have a second surgery in November, and she's doing what's called a DIEP. So they'll take a portion from my belly to reconstruct the left breast. What they do is complicated and difficult. So, she's been great so far. She explains every step of the way, makes it so I understand. So I would just tell her that I appreciate her help and everything.
Boy, complicated and difficult might be understatements right there. Luckily, we have these 2 brilliant doctors here today joining us, microplastic surgeons who perform breast reconstruction for cancer patients, Dr. Julie Holding and Dr. Rebecca Farmer. Thank you for taking time to join us. Dr. Rebecca Farmer is Christie's doctor, and joining us remotely is Christie Ellis, who you just saw in that video. Christie, thanks for joining us. You're looking really great. I got to say, you have such a bright voice and disposition in that video at a time that must have been so stressful. How are you feeling today?
I'm feeling great. I had a lot of confidence in my doctor, so that helped with my disposition, and just knowing that it could have always been worse, and that I had the best team behind me.
I want to ask you about your decision to opt for the specific surgery called DIEP reconstruction. It's spelled DIEP, pronounced DIEP reconstruction. I want to turn to our doctors and our surgeons here in the studio to talk about that as well. What made you pick that choice?
Well, it didn't take me much time to decide on it. Dr. Farmer explained all of my options. And this just seemed like it was a very intense surgery, but it had a more lasting effect for me. And it seemed to be just the best fit for me personally.
Dr. Farmer, you're Christie's surgeon. Christie has described her tumors were benign but aggressive. So do you know what was causing the tumors?
So she had a tumor called a phylloides tumor, which I don't think any doctor really understands exactly what causes this. Like other benign tumors, say a lipoma or something of that nature, sometimes cells just get the wrong idea and start over proliferating. So even though they're not cancer, they do cause trouble. In her case, her tumors were quite large. So even though they weren't a malignancy, they were still causing her quite a lot of discomfort and really distorting the appearance of her breast. So
Right.
and they can't actually turn cancerous. So
That's a huge concern.
that's right. So it's really important for her to have them removed.
So the deep reconstruction, that takes several hours. Is that, doctors, is that longer than a typical reconstruction surgery, and how much longer? I'm going to go with Julie Holding for that. Dr. Holding, excuse me. Casual Friday.
It's a very technical surgery, and so it does tend to take longer. There's, we have surgery in the chest where we have to get the vessels that we are going to connect to, and then we have to dissect out on the abdomen for the deep. So yeah, it does take longer. I mean, if you were to do an implant surgery, for example, it could just take a couple of hours, where this, it could take, for both sides, it can take anywhere from 8 hours, give or take a couple hours.
So how do you prepare the patients for that kind of a surgery?
I just tell them just that, and tell them that they're going to be asleep, so they're not really going to know. It's really the family members that are going to be sort of waiting out that time. But they do pretty well. They actually tell me a lot of times it's actually easier than after their mastectomies.
Christie, how did you feel afterwards? Were you in a lot of pain, or did you feel more the emotional relief of knowing that part was over?
It was painful, but like you said, it was a relief that part was over. I had prepared myself for the worst, and afterwards it made me realize this wasn't so bad, and it was the best thing for me.
We do have some video that we want to share with our viewers of this DIEP surgery. How did you know DIEP was a procedure that you wanted to provide to your patients, doctors? I'll start with Dr. Farmer.
I think, in Christie's case, she's a young lady. She has a lot of life to live. And in this case, certainly using your own tissue is going to be far more durable in the long term than an implant-based reconstruction. But that's also a very personal decision for patients. So I just like to be able to offer kind of the full spectrum of reconstructive surgeries. And in this case, this is what was going to work best for her.
And are you both microsurgeons?
Yes.
I've got to ask, I know what a surgeon is. What's a microsurgeon?
So there is a specialization you can do in plastic surgery where as a part of what we call the reconstructive ladder, where you just close things, let things heal on its own, all the way up to where you can take tissue off of a patient and transplant it to a new area. And with that is with the use of an operative microscope. And so it's a super specialization, and some specialties have that, and plastic surgery is one of them. And so it's really nice to be able to offer the full spectrum to our patients.
So what do you watch for as a microsurgeon after a DIEP procedure?
You look for, physical exam is always a great way to just examine. You want to look at, the color, how soft the tissue is. And we also look at, like say you push down on your hand or your finger and you see the color go away and then it fills back up with color or red. That's called capillary refill. And then we also actually listen with a Doppler to listen to the heartbeat of the flap.
So are you able to restore the breast sensation after this? Dr. Farmer or Dr. Holding, who would best answer this question? Would be
there are certainly studies that are ongoing now looking into re-innervating flaps. So when you are harvesting the belly tissue, you can actually take some nerves with that as well, and then hook those up to nerves in the chest. Some members of our microsurgery group are studying that actively to see if there is the ability to restore sensation. I would say the jury's maybe still out, but it's something that we're actively studying.
Yeah.
I haven't participated in that. I do have quite a few patients that have sensation without doing that. And it is any kind of sensation right now that is restored is more protective sensation. So like pressure, hot, cold, those kind of things.
So Christie, you're going to have the final procedure next month. Is that correct? To do the full reconstruction of your breast?
Yes, correct.
And so how long will the wait have been between the removal of the tumors and then that final surgery that you're looking forward to next month?
It will be about 3 months.
Okay, is that typical, Dr. Farmer?
That's fairly standard in my practice. You can do this type of surgery in an immediate fashion, so at the time of the mastectomy, and you can also do this in a delayed fashion, so where we place a temporary device, wait a few months for sort of all the inflammation to go down, and then come back. That timeline can be longer as well, depending upon what patients may need in addition for their cancer treatment. In Christie's case, she had a benign tumor, so she didn't need any ancillary treatments, but certainly some patients need radiation or chemotherapy, and that can sort of prolong the interval in between their initial stage of reconstruction and then the final reconstruction, whether that be placement of a long-term implant or tissue-based reconstruction.
And so what about the nipple? Are you able to reconstruct a nipple or save part? How does that work?
Saving a nipple, I always tell patients that if it's oncologically safe, then we can try to save the nipple. But as far as reconstruction, it's the last part of reconstruction. It's kind of the finish. And so it can be done as an easy procedure in clinic, actually, and local anesthetic, especially because most patients are surprised that they actually have sensation. We just do a little rearrangement of some of the tissue, and you can have a little projecting nipple. A lot of patients though now don't really want to have a projecting nipple all the time because they really enjoy not wearing bras.
Right.
So they just
that would be an unexpected
so
benefit to something like this, right?
So they just do 3D tattoos.
Oh, that's brilliant.
And it looks just like a normal nipple.
Do you have someone that you will recommend to get the 3D tattoo from? Like, do you know tattooists that are specific to breast reconstruction?
Yeah, there are a lot of guys in the community who've been touched by breast cancer with their wives, family members, and so they started offering this technique. But we also have someone in our clinic one of the nurses who offers it.
Do you know if insurance covers that? It should.
It typically does.
It should.
Yeah, breast reconstruction and
it should
all
cover
stages.
All of it.
Yes, federally mandated.
Yeah, federal law mandates after a mastectomy all reconstruction.
Thank God it does, because that's something that's you want your body back, and it's okay to want all of it if you want the full reconstruction.
Absolutely.
That's great. Oh, that's such good news. Now I have a question, because earlier this month the FDA warned of squamous cell carcinoma and various lymphomas in the scar tissue or capsules surrounding artificial breast implants. So my question is for women watching who have implants, is this warning for all women with implants or just breast cancer survivors with implants, Dr. Farmer?
So really the warning is for all women with breast implants. So whether that be in a cosmetic augmentation situation or a reconstructive situation. We have known for a long time about a particular kind of lymphoma, breast implant associated anaplastic large cell lymphoma, or ALCL. And so that's something that we've been actively tracking, and all implants that we put in, we have a registry so that we can keep track of patients. And as far as we know, that's associated with a particular kind of breast implant, which is a textured breast implant.
Okay.
The squamous cell news is, I think, all news to us as well.
It's very new.
It's very new. So we're not even, I think we're kind of still catching up to that and trying to figure out if there's a particular type of implant it's associated with. But really, there's only been a few case reports, I think, that have come out at this point. So we're all playing catch up to that, I think, a bit.
The one thing to note, though, is both of them are extremely rare. And the lymphoma, kind of the literature now that we're seeing, about 700 patients worldwide, so millions of women with breast implants, and 700 right now are documented, and again associated more with textured type implants. The average time of onset has been about 8 years after an augmentation. So the longer you have it, that's kind of what we're seeing. And the same thing with the squamous cell is the longer that a patient has had the implants, that's when they're seeing those kind of things, but again, extremely rare, given that there are millions of women with implants.
And only 700 cases that you know
of the ALCL.
Okay. We're going to get to community questions in a moment because we know you have a lot of questions if you're watching from home. But first, we want to check in with Dr. Dana Hawkinson, who's the Medical Director of Infection Prevention and Control, with our COVID numbers as we head into the weekend. Big weekend with the Chiefs playing on Sunday.
I know, it's going to be a big game for
Yeah.
sure. Hopefully be nice weather too. So right now, 18 active infections in the hospital, which is really good. We've seen that number drop from the low 30s down to 18 now in the last week or so. 1 in the ICU, 0 on the ventilator, still 19 in that recovery period as well. So overall, I think it's doing well. We know that SARS-CoV-2 circulation in the community is still fairly high, but it is decreasing, and that's always good news.
Dr. Hawkinson, there's a medical headline that I want to bounce off you. Researchers working on a cure for HIV and AIDS say that the pandemic slowed down their work by 2 years. What is this impact going to have on patients and the doctors who treat those patients?
Yeah, I mean, that's probably 2 calendar years, I think, in the context of research and all that. It could be even more. I think this is not just for HIV research, but really a lot of different research, a lot of public health initiatives, such as vaccine programs as well. This is very impactful. This has been very impactful. We have seen the pandemic has been impactful for communities and people individually as well. In many, many different ways. This is unfortunately one further way which we have seen as either supply chain problems or resources and activity and time were changed to the pandemic, to SARS-CoV-2. But hopefully we can get back on track soon. But yeah, this is absolutely true, not only in HIV, AIDS research, but also just various aspects of science as well.
I want to ask if we have any reporter questions today. Any reporters on the line? All right, we do not have reporters on the line right now, so we want to go to some questions from our viewers because we have quite a few. Tiffany wrote in. Tiffany wants to know, how long do breast implants last, and is replacing them harmful? Dr. Holding?
So there really isn't a hard and fast rule as far as the timeline. Manufacturers and even the FDA says, you should get them replaced at some point. So the guideline that I typically say is, we form scar tissue around any foreign object, and whether that be like a splinter to a breast implant, and sometimes that can get firm and hard and sometimes uncomfortable or just look asymmetric. And so if that occurs, that can be a good time to have it done. Or if somebody would like to change the size, but having them checked regularly is a good idea. And some people say 10 years or so. It doesn't mean that you have to have surgery at 10 years, but it would be a good idea just to check and see if there's anything going on.
Is it possible to get implants at 25 and then have them your whole life and be fine? Or will you have to get them replaced at some point or another?
You probably shouldn't keep your implants in for that long.
Okay.
As Dr. Holding said, really the FDA recommends exchanging your implants after about 10 years.
Okay.
Certainly have I known patients who have had implants in for 30 years and never had a problem, for sure.
Right.
But at the same time, I think
You wouldn't prescribe that?
I would not.
Okay.
Maintenance is important.
For everything, your car, your breasts, everything.
right.
We're going to keep it up. Okay, Angie wants to know, who isn't a good candidate for deep surgery? Is there anyone where you will counsel and say, no, I can't do it on you?
So I say if you're a good candidate for a tummy tuck, then you're a good candidate for a deep flap reconstruction. And I've done that even on, thinner patients, which is limited though, because if you don't have a whole lot of fat, then you don't really have a huge reconstruction if that's what you're going for. And then on the opposite spectrum, patients who are, overweight, extremely overweight, it carries a much higher risk for major complications and firmness, infections, wounds, those kind of things. And then of course, patients who've had tummy tucks before, paniculectomies, major medical issues or problems, and a lot of time, stage 4 breast cancer, unfortunately, isn't a candidate.
Okay, that's a good insight. Randy wants to know, after seeing all our stories on the KC Pink Warriors, how important is it to exercise after your treatment? I'm going to ask Dr. Farmer about this.
I think it's incredibly important to stay active after any surgery, really. certainly we will put some restrictions on what you can do. But at the same time, I encourage all of my patients, we don't want you laying around in bed. That's not good for your recovery. And really, you want to be up and walking, doing your own kind of activities of daily living, getting to the shower, going to the kitchen, walking around Target if that's your thing, so
You're prescribing Target, shopping at Target.
Honestly, can't hurt.
I like that. I'm going to tell my husband. And I talked to some brilliant
That's what I tell my
doctors,
husband.
and they said,
So, I think it's really important for patients to stay active, do what you enjoy, if that be Target or whatever that may be. And it's just good for your mental health as well to be up and about.
It's so important to your physical health. Christie, what about you? How did you get back on your feet after the initial surgery, and what are you looking forward to doing now that you can see a light at the end of the tunnel?
Well, I had a lot of support from family and friends for sure. A lot of help at first. I was a little stubborn, as Dr. Farmer might tell you. I tried to do a little too much at first, but just know your limits. I'm looking forward to this being done and hopefully getting back to being active, going to the gym, and just getting back to normal life.
What did Christie do that was too much? Did she try to climb a mountain or something?
She didn't. I think she just tried to, go back to her normal self
She
right
did
away.
back-to-back Target visits.
Exactly. She just too much Target, basically.
It is so nice to see a patient so happy and smiling. And I mean, it's not a surprise to be so confident in our doctors, but you just look great, Christie. I do have a question from Isaac. This is for Dr. Hawkinson. Isaac writes, I read the study by the Department of Health and Human Services that 2 doses of COVID vaccine prevented at least 330,000 deaths and nearly 700,000 hospitalizations among adult Medicare recipients. So Isaac goes on to write, if this is the case, why are more Americans not getting vaccinated?
Yeah, and the boosters are projected to save even more lives moving forward as well. It's hard to say. I think it's a combination of facts. I mean, obviously, when we're dealing with medicine, there's always different details. Certainly when we're dealing with the pandemic, there's different details as well. And there's so many information points that we have to take. And, there is that COVID weariness. I think people have just kind of gone about their daily lives. We've heard about the pandemic being over. And basically what that means is really the virus is no longer dictating what you're doing. You're going about your daily life. So I think there is that weariness there. There are also people who have been vaccinated and infected or reinfected. They've certainly had several exposures to the spike protein in that way. So I think there's a varying amount of reasons as to why more people aren't getting it. Certainly if you fall into that group of 50 and over, as was recommended for that, that first booster essentially, or especially if you are 60 or 65 and over, as an individual, it is going to behoove you and be most important to help protect you against that hospitalization and death moving forward. So hopefully we do get more people taking up the booster and the vaccine, just so that we can reduce your risk of going to the hospital so you can stay at work and keep you and your loved ones healthy.
I want to bring in all of our guests for some final thoughts. And Christie, I want to start with you. If you have any messages for your doctors here or for other women who are watching and considering a DIEP reconstruction procedure.
Yeah, I just want to tell Dr. Farmer, like I've been telling her from the beginning, thank you. And I appreciate her, fully explaining everything to me, putting it down, to my level so I understand. And then for women out there, just get checked. You never know, even if it's not cancerous, it can still be harmful to your body. So just make sure you're getting checked and talking to your doctors.
Dr. Holding?
I just want to say that, know that we're here. We have all kinds of options to personalize what you would like. It's a journey, and oftentimes we become like family. So make sure that you seek out the appropriate plastic surgeon for reconstruction.
Dr. Farmer?
I would echo that as well and say, we're here to try to provide the best individualized care that we can. This is not vanity. Some women will come to me and say, I don't really need breast reconstruction, that's just vain. And I tell them it's so important to their mental health and their quality of life. And so we're here to do whatever we can in our power to help restore that for patients. And I would also like to say thank you to Christie for agreeing to do this and for being such a wonderful patient.
It's such a great point about people mistaking it for vanity, because I have girlfriends who've had breast reconstruction surgery who didn't want it at first because they were afraid they were asking for too much. One of my friends said, well, I already survived the cancer, so why would I look a gift horse in the mouth? And that's such unfortunate thinking. And so I'm very happy to hear you saying that to all the people watching. Dr. Hawkinson, what are your final thoughts?
Yeah, just again echoing what our guests have said. I think it's so important, and I think, we are so grateful that we get to work with great colleagues like this and also help the patients on a daily basis. So just again, continue to give more thanks to our providers, our doctors, our surgeons, nurses, everybody that cares for patients that come in for these very important medical issues.
So we want to wrap this up on a light note. It's Foodie Friday, so this is usually a day, Foodie Friday, when we show you something delicious and healthy to make. Well, today we're showing you how to make, we got half of it right, we're showing you how to make a fried chicken and waffle sandwich. Now here's the caveat. Typically they run about 1,700 calories. So today Chef Eric King has been put to the test. He's going to show us how to make a lower calorie version. And Chef Eric, it's not just telling us to take like well, one bite, one tiny, teeny bite.
One bite.
What makes it lower calorie?
No, well, make these at home if you'd like. You can use your that waffle iron you've got tucked away in the pantry that you've never used since last Christmas. Hand bread these yourselves. Use your air fryer. If you got that mode on your oven. We're baking ours today, but traditionally we, for the retail cafes, we'll be deep frying these so we can get these out very, very quickly. We start these off with a spicy syrup. Use a little bit of our maple syrup here. A little lemon juice. A little sriracha for that kick. A little fresh garlic. And mix that up real nice to get a nice little syrup here to drizzle on top. And let's see how we've got these going in the oven. Now, for the sheer sake of doing this quickly, because we have to make around 600 of these today in all of our retail cafes, we went ahead with a pre-made waffle, home-style breaded chicken breast, some of our spicy syrup right here. I like it on the hot side, so I add a little bit extra there. Top it off with our waffle and some of our baked waffle fries. You could also at home maybe make a sweet potato fry for a little bit of healthier touch. And that will be available in all of our retail cafes today for Red Friday. That is our Arrowhead Crunch Sandwich.
Oh, that looks so good. So how many calories would you estimate if you bake it, you do the hand breading, and you have your own waffles? How many calories?
Around 660 calories.
Okay, all right.
Not
that's a lot better
Not the
than
calorie bomb
1,700.
that you would get at the stadium.
Right, right.
Yes, it is.
But nothing counts. When you're eating it at Arrowhead, it doesn't count. It doesn't have calories. That's what we tell ourselves.
Absolutely not.
Chef Eric, thank you so much. It's great to see you again. And thank you so much for being with us today. Remember, you can catch our updates anytime by logging on to Facebook, YouTube, and Twitter. Go out and make it a great weekend, and go Chiefs. We will see you right back here Monday at 8 a.m.
Coming up Monday on the Morning Medical Update. What started as the flu led to a life-threatening infection in this man's heart. But a second opinion gave Kyle Warren a new chance at life and a new heart. I'm Jessica Lovell. Coming up Monday at 8. Meet this father living life to its fullest and the mother of the young man who gave the ultimate gift.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.